For this lab, lab 3 will be dealing with joint mobilization for our spondylolisthesis patient. Many PTs would tell you that joint mobilization is not a thing that you really need to be doing with spondylolisthesis, but there are a few things that we can manipulate to make work. The first thing is pelvic tip. So get them, normally you'd get them to sit on the edge of the table and lean back, so they'd be laying down with their legs hanging off of the table. But for this case, I'm going to show you standing for the sake of videoing. So you'd run your hand up to the point of the iliac crest. You'd feel right behind their hip here, and what you get them to relax their core, relax their back, and then you would manipulate the anterior tiltage and the posterior tiltage. So you could do this for about 30 seconds, get it moving again, get the anterior, get the pelvic tilt to anteriorly and posteriorly rotate. The next thing we could do is back flexion. So one thing that many of the PTs that I found reading about this say is that you do not want to do much extension for spondylolisthesis. That's definitely a contradiction. But for this case, we're going to do some mobilization forward. So get the patient to lay down on their back. Get them to put their legs together and then lift their legs. And what you would want to do is you'd want to grab right at their calves or maybe close to their ankles and really push. And what that's going to do, it's going to open up the disc between the lumbar spine and the vertebrae, and it really open that up and get maybe some more movement and mobilization there that they normally wouldn't get just guarding their muscles and moving around on a daily basis. Try to get some of those things, some of those vertebrae moving again. So those are two that we can use. Again, spondylolisthesis, especially a grade 3 and higher, can be really delicate dealing with joint mobilization, but those are some two that we can manipulate to make work for us.